Hi, I'm Dr. Stephanie Saucier, a cardiologist, which means I specialize in treating patients with heart disease. Specifically, heart failure is one of the diseases that I treat. Today, I'm going to be answering the most common Googled questions about heart failure. So let's jump into it. Question number 1, can heart failure actually be cured, or will I have it forever? Well, the answer is that it depends on why you have heart failure. Some heart failures are able to be reversed. Other heart failures are not and are chronic. These chronic forms of heart failure are really manageable with lifestyle changes, medications, sometimes intervention, but ultimately it depends on why you have heart failure and how bad it is. Sometimes we can make things better. Sometimes patients will need advanced care for serious forms of heart failure, and that's where our advanced heart failure specialists come into play. We use things such as advanced mechanical supports, medications, and transplants. But lifestyle medications are really key to improving symptoms. If you do get diagnosed with heart failure, it's not the end of the line. You just have to manage it and work with your doctor. Do I need to go to the emergency room if I have heart failure? It really depends on how you're feeling. Not everyone who has heart failure needs to go to the emergency department, but you want to watch out for some red flag symptoms. If you can't breathe while you're sitting up or laying down, if you notice that you're having significant swelling in your legs, your belly, if you're having difficulty walking short distances, okay? There's a couple things that we also want to take into consideration. If you're sleeping at night and waking up gasping for air, that's a sign you might need to come to the emergency department. If you're really fatigued, lightheaded, dizzy, and you have a diagnosis of heart failure, also a good time to come to the emergency department. Sometimes symptoms can be managed with infusion clinics and with your outpatient cardiologist, but if you're noticing any of these red flag signs and symptoms, it's always safest to go to the emergency department to make sure that we can appropriately treat you. You might have to be admitted. It's really important that you take your medications and keep with your diuretics, especially if you're prone to building up fluid, because that's how we're going to keep you out of the hospital. Question number 3, can heart failure get worse if I don't treat it? Yes. If you don't treat heart failure, it gets progressively worse and can cause death. Heart failure is a leading cause of death when it comes to heart disease processes. Unfortunately, the number of people affected with heart disease, specifically heart failure, is increasing over the years. Early intervention with lifestyle, medications, and advanced therapies, if needed, is going to help you live a lot longer. And so if you want to check out our video about medications that help you live longer, you can check that out. If you don't treat your heart failure, you have a much higher chance of it getting worse and potentially becoming fatal. Question number 4, do the natural cures I see online work for heart failure? Some holistic options do help, such as diet, exercise, treating sleep apnea, stress reduction. These are all important things when we're talking about heart failure management. Ultimately, evidence-based treatments are where we rely because these are the things we've tested over years and a lot of people to see what makes people live longer who have heart failure and what actually works. Make sure you're consulting with your physician. It's also important to recognize that medications are supplements that you may take or may be recommended online or holistically, might not be FDA regulated, and may interfere with your heart failure medications. If you are going to take medications or supplements online, talk to your heart failure specialist, talk to your cardiologist, and see what they recommend in terms of taking these medications or not. But ultimately, lifestyle, exercising, healthy diet, taking our medications, that's what's going to help you the most. Heart failure is a serious diagnosis and can be a very scary time for both patient and family. I want to give you a lot of hope that with the right medications and the right doctors on your side and you doing the right things from a lifestyle standpoint, can live a happy, healthy life for as long as we possibly can with all of the technology and support that we have. Just because you have a diagnosis of heart failure doesn't mean that you can't continue to live a happy, healthy life. Please continue to work with your medical team to make sure you're doing all of the right things. If you liked this video and you want to learn more, please like and subscribe. We also have a free heart health guide that you're welcome to download. That will be in the link below as well.